Hello and welcome. Bienvenidos, bienvenidas.
Welcome to this HIV 2020 online session on harm reduction, drug policies, and HIV. We are so excited to meet today and being able to share with you. My name is Sara Snap from the RIA Institute, and today we will start this session. Briefly, we would like to give some announcements. The first one is about the interpretation services. If you need interpretation, you can choose the audio channel for the language of your choice. You just click in the icon that says interpretation, and then you can choose the language. Most of this presentation will be held in Spanish, but we also have interpretation in several languages. So thank you for being here today, and I will show you then the next slide. These are some of the participation guidelines. We would like to have an open session with a safe environment and space so we can really share as best as possible. So the HIV 2020 online sessions offer a safe and neutral space for sharing of knowledge, experience, skills, and opinions in a mutually respectful manner. HIV 2020 Online operates on a zero-tolerance policy for any kind of bullying, harassment, abusive use of language, aggressive expression of opinions, or any such undesirable behaviors. This includes any activity during the Zoom sessions such as the one or on HIV 2020 online social media platforms such as Facebook, Instagram, Twitter, YouTube. All these group discussions, the platforms, and all those questions open in Zoom, those chat boxes in Zoom, as well as on private chats that might cause any distress to the panelists, speakers, translators, and/or participants. People in charge of the session will remove, and without prior notice, will remove all those who engage in such actions during their participation. So we will be here moderating the session, and we are so happy. In a short time, you will know all the speakers.
La siguiente lámina, por favor. Y solo para decir que esta sesión va a ser grabada.
Just for you to let you know that this session will be recorded and also will be included in the HIV 2020 social media platforms, as well as from some of the organizations, and it's been broadcasted live through Facebook. This is really important because if someone decides to participate just to know what is best with regards of these personal items, when we are divided in the breakout rooms, there will be only one group shown in Facebook, but the rest will be in their breakout rooms. It is also important to highlight that this will be included in some other social media, so you need to be aware of whatever you say. And finally, we also send it through the email. If you want to change, if you can change your name, as you notice here, please change your name, rename your Zoom name. Wherever, you just need to click on whatever your name is, follow the three dots, and then you just click on rename, So you can add your language. It could be English, French, Portuguese, Russian, and Spanish. And after that, write down your name. And that means the language that you will be listening and also participating in the breakout rooms, because that will help us to create the groups and to divide them for those small participations. It seems that you are not listening to me. Can you hear me? I think that the rest, it seems that it's only one person that is not listening. So if you can rename yourselves, including or adding EN for English, ES for Spanish, PR for Portuguese, and so on, and that will help us to create the groups so we can start with this session. Thank you very much for your participation and collaboration in the chat box. Next slide, please. So, for you to get to know us a little bit more, I will later help you with renaming yourselves. So for those who will start, if you can open your videos, we are divided in groups of 2, but we are so happy to have you all here. If you can just say your name and your organization and where are you from, where do you live, and so that in that sense we can start. As soon as I see my colleagues, we can start with Angelica. My name is Angelica Ospina. I'm from the Mexican Network of Harm Reduction, Redumex, and I'm from Mexico. I live in Aguascalientes. Welcome, everybody. Ernesto? Hello, my name is Ernesto Cortés. I'm from LANPUT, the Latin American Network of the Caribbean on Drugs Use.
Cintia, no te escuchamos.
We cannot hear you, Cynthia.
Perdón por eso.
Sorry.
Soy Cintia Navarrete.
My name is Cintia Navarrete from the APROACE organization in Mexico, and I also belong to the Latin American Network of people who perform sex work, Blackbirds. Thank you.
Hola, buen día. Mi nombre es Fanny Pineda.
Good morning.
Soy parte
My
del
name is
LAMPUT,
Fanny
de
Pineda.
Reverdecer
I
Colectivo
also
y
belong
del
to
Programa de
LAMPUT
Análisis de
from Reverdecer
Sustancias en la
Colectivo
Ciudad de
and the
México.
Program of Analysis of Substances in Mexico City. Hello, my name is Montserrat Angulo, and I also represent Reverdecer. My name is Jorge Herrera. I collaborate in the RIA Institute. We are an organization that carries out research and advocacy in drugs implementation, and right now I'm in Mexico City. Ingrid? Hello, my name is Ingrid Farias. I'm from Brazil.
Com políticas de cuidado e atenção às pessoas que usam drogas e faço parte da LAMPUT.
I belong to an organization that gives care and assistance.
escuchamos, Arturo.
Boas tardes aqui do Brasil. Me ouvem? Me ouvi agora?
Sí, te escuchamos, sí.
Boas tardes a todas e todos, né? Também da Escola Livre de Redução de Danos, aqui em Recife, no Nordeste do Brasil, desejando boas-vindas aí. Nós estamos atuando aqui enquanto organização, incidindo politicamente na política de redução de danos.
In our organization, we do this advocacy work in the communities in our region, and we also carry out different research and investigation, specifically with those population in that consume drugs. Hello, everybody. My name is Marisela Perdomo from Honduras, and I belong also to LAMPUT and also to the pro-legalization program in Honduras and to the Equilibrio organization in Honduras. My name is Sara Aznar from the Institute RIA, and also I belong to LAMPUT, which is the Latin American network of people who use drugs, and I also live here in Mexico. So we are so happy that we are able, we would have liked to kindly welcome you to Mexico City in July, because originally that was the plan, to have HIV 2020 in Mexico City. We were so excited. We were organizing that since last year. Unfortunately, that is not possible, so that's why we organize this session. And HIV 2020 is organizing a lot of events during this whole month of July. So we're so happy to be here today. Now, all these speakers will be moderating the sessions once that we are divided in these breakout sessions. Right now, I will share the screen so Jorge can start.
Listo. Entonces, lo voy a poner en presentación. Súper. ¿Pueden ver mi pantalla?
Can you see the screen?
Okay. Yo me voy a quitar de video y Jorge, tú adelante.
Muchas gracias, Sara. Hola a todos.
Thank you, Sara. Thank you.
Desde diferentes latitudes,
From different
distintos hogares,
spaces and different areas, let's remember just these indications that we just gave, that you just need to include your name from the beginning and the code of your language that you speak. Your name is also important. And if you have any doubts in the chat, they are just supporting them. So today we will speak about drugs. We will speak about drug policies, but mainly we will speak about those situations, behaviors, phenomenon, challenges, and needs that go around this issue. So first, explaining and talking about a policy that includes or that refers to this topic of drugs is the banning policy, where the state members, on a general basis, they just criminalize. They criminalize all the activities, attitudes, behaviors, uses related with drugs. And it's not only the use, but also all those activities that are related with the marketing, trading, and distribution of drugs. We, as users, leave us aside in a very uncertain legal aspect, and in that sense, we face great violations on our human rights. And we can say that regarding the criminalization on having drugs and how, on a general basis, this turns into extortions from the authorities, from the governmental authorities, from the police members, from the security members of the State's Department against users of drugs. And in that sense, they alter or they violate our human rights. criminalization and this banning policy with regards of the use of drugs, and of course the discourse and the narrative used from the government and from the states relating this topic has created a stigma that it's been replicated in different several social actors. For some of them, this will represent like a barrier and not allowing them to have opportunities and violating their human rights. So in that sense, we as drug users, we face this stigma, we face discrimination. So in that sense, criminalizations starts this stigma, creating this double vulnerability, and we are not able to exercise and practice our human rights as individuals. So it is important to recognize that the first center or the first core where we live that it's in the family. When decisions are making without asking about the needs and without asking the opportunities that we might have. Another area or another space where these discrimination attitudes are replicated, of course, it's the school. And in that sense, it also reflects different information that it's not based on evidence with regards of the use of drugs. Instead of providing information, instead of providing accurate information, and also not incorporating these strategies on how to reduce risks with regards of the use of drugs, and also to end on this use in a very committed way. So in this sense, stigma and social discrimination had created great consequences, serious consequences. We need to remember that the use of these drugs and as well as psychoactive substances, it represents a risk of the health, depending on the organizations. And something that it is also important to consider is the uncertainty on the quality of those substances because of these legality issues and the black market where they are found because of this banning policy and some other elements. Some individuals, when they use these substances, sometimes they might have this problematic behavior, and some other institutions are related with this use, but on a general basis, they don't follow these ethical aspects, and in some cases, they just fall on violating human rights. So that's why we also need to support, we need to provide services and care for those who use drugs and also for those who also abuse on the use of drugs. However, this is not a reality in many other areas. Stigma doesn't allow people to speak openly about their consumption behaviors as health professionals or as some other factors that can promote public or private services. And also these emergency services, they only provide care for those who go there because of several reasons, or they just stop providing these services based on the statement that they are people that they just got into that situation because they consume or they use drugs, or mainly because they don't deserve to get those public services because of the situation that they use drugs. So this situation is also reinforced with the criminalization, and it is evident when one person that uses drugs not only requires these health services, but also they face these situations when they get into conflict with these legal aspects. It is difficult then to get legal counseling and the lack of health services. And for those who use drugs, if they consider these stigma and discrimination issues, they happen and they occur in different spaces, such as school, the area where they work, or governmental institutions. Angelica, I don't know if you want to mention something. This is just to remember that stigma kills. That stigma, it's not only these abstract ideas, but also stigma, as Jorge was saying, is this, we cannot say that they are set aside, So there are several discourses that had pulled us to several ways of thinking as we users of drugs, and how society also is representing. And why do we say that stigma kills? Because it faces us to different situations to have this compulsive behavior. This is a common practice, and this also has been shown that it is not only the one that creates these problems, but also it makes more acute, it intensifies it, and that turns into death in some other cases. And also to these human rights violations. As Jorge was saying, stigma makes us be aside or apart from school or from the work, because they say that society says that we need to keep aside the rotten apples. So if they are just experiencing the use of drugs, so they don't contaminate their colleagues or their peers, instead of using it as more from a community perspective. There are some other companies that it is a common practice to develop these anti-doping tests in order to remain in the company or in order to be accepted. So this is an exclusion attitude that left aside so many other people that might have low resources or low social capital. It also limits us to relate with some others who do not use drugs, who do not use substances, and with this idea on cutting relationships. And in that sense, also the social network, the social networking, it's also cut. It doesn't allow us to be in social spaces. And in that sense, it is also important. As Jorge was saying also, we don't have access to legal services as well as on health services. So we have this exclusion from police officers, and these are the conditions of the users that, and sometimes we are afraid of facing these situations. And in that case, for women, we cannot exercise our right to have to be pregnant without considering any other conditions. And sometimes we also face these forced sterilization processes, and that also limits our access to health services. And with relation of HIV, sometimes we are forced not to use drugs in order to get our antiretroviral therapy or treatment. So in that sense, that's a human rights violation. When we go to the emergency room, for example, there is not substitution or replacement therapy. These services are not available, and there is no free naloxone in these communities. And if we need to appeal this civil survival to have this resource. And finally, the ER rooms makes that they give us a delay on giving us and offering the services. So these are the behaviors that we face, and we don't have this access to justice. Let's say that when someone is killed, and if it's related with the use of drugs, then they just stop the investigation because they say that we deserve that, and in that case, it's violence. So we, as users, we had also believe on that discourse, and in that sense, that's make us difficult to raise our voice and to express our opinions. And finally, stigma and discrimination for all these reasons also increases our development, our growth, because all the other possibilities are got to be included in the social world. Thank you.
Gracias. Sí, bueno, y esto es por el lado de.
Yes, and this goes with these experiences and challenges that we have faced, mainly because of the banning policy and because of the path that they had followed with regards of the situation with the use of drugs. And in that case, is this war against the wars. This is a war against drugs, and we say that this is a war against people also, because just to be more specific, let's just mention that in the world, 1/4 of the world population of the total population use drugs, ages 15 to 64. 5% of these people use at least one drug in 2015. We should have more updated figures, but in this sense, we can have like a general idea on saying that only the 11% of those people who use drugs from that fourth of the world population has faced different problems related with this topic, with drugs. So that is to say that we have 89% of people who hasn't faced these problematic uses, or that they haven't faced any higher risks or any higher problems related with drugs. However, the banning policy and the war against drugs is maintained, is sustained, justifying just the fact that they have these interventions towards these 11% of the population that is shown in the media as well as on social media. So that is to say that this is a group that has to be taken care of, and that has to be, that these policies and strategies has to be directed to, and that these are like criminalization policies and punishment policies that instead of finding solutions towards the problem on the illegal use or the different uses that they might face with regards of drugs, it goes beyond that. It goes far away from this. So, despite the fact that there are several herbs, mushrooms, and animals that have these psychoactive substances, unfortunately, those countries had decided to face this criminalization against these activities and behaviors. So it is not a coincidence that 1/4 of the world population are these crimes related with drugs. And this is more evident also when we analyze when we mention the 32 countries that have this death penalty with those offenses or those crimes related with this topic. So this situation has been provoked by this banning policy, and it's been started by the state members, but it has been kept and maintained and supported by the United Nations, despite the fact that the United Nations has just realized and has recognized that there are several consequences that are non-intention consequences to this current policy on this banning situation against drugs. Some of these consequences include the creation of a criminal market that is illegal, and also that it is regulated by violence that put us at risk, we, the users of drugs, because we are in contact with an illegal market and a black market and aggressive market, so we can get our drugs. So, these state members had this punitive approach, and that goes closer to criminalization, and this is just sets aside these health policies and these objectives on reducing the offer and the demand of substances. And in that sense, the next items refer to that, to these substances with regards of the use. They have a low impact in the demand of the substances. And we say that they don't have like this advocacy on reducing the market. But when we have these repression policies, the only thing that happens is that the users, they just try to have access to these through different vias. And when the product is not in use, then they go to use some other analog or similar substances that might cover our needs. On the other hand, this geographical displacement speaks about the low impact that this banning policy has had on reducing the offer of substances, and without this psychoactive substances. So there's no impact on reduction. And the thing that happened is that instead of producing it in several regions, or those plants or those psychoactive substances, the production is displaced to other areas. And it is evident in Mexico, for instance, that in the same that happened is that production is displaced to some other regions, such as the south. So this is also seen in regional geographical areas. And we also, as we also mentioned, this stigma with regards of the users and with this banning policy. And briefly, just to mention this study that was carried out in Canada in order to identify some of the reasons why people use plants and psychoactive substances. And in that sense, they mention experimentation and also the search of health and well-being in order to improve our body conditions, our human conditions. Of course, we also have pleasure and self-exploration, being able to get to know our bodies and our mind, improve social interaction with a group and in specific communities. Also, the connection that we face with our environment, with those who are sharing with us, with our objects and also with our activities. This is something also that the idea is to have less or no attitude to do things or not. Substances in that sense are involved here. And I would like to add here, sorry to interrupt you.
No, está bien, lo estaba escuchando. Sí, creo que no es un trabajo más.
Yes, I do believe that this is not an additional job or something else. Besides that, we need to work and we need to see this work from Emerson and Haddon as the most important thing in this description is that these are just some bullets that besides we are trying to speak about health and well-being, we need to speak about also pleasure, that we use these substances and that we use these plants. It is important just to make it easier, these sexual behaviors, and also to improve with all these cognitive issues, to fight against being tired and also to recover some sensory activities. And for recreative aspects, it is also important, not only thinking on harm reduction, but also thinking on the banning. And I do believe that these are also used for these treatments, dependency treatments and mental disorders. So this clearly marks that these harm reduction programs, they do not include substances, but the fact that they have when they use them. And also the stigma that Angelica was mentioning with regards of this masking the problematic use, because it goes together with this banning policy. And in that sense, I think that this is something important to mention from this harm reduction approach and not from the use or abuse of the drugs. Thank you, Vero. Yes, I just want to mention that this banning policy, what they are doing with this banning policy is that they are just not allowing us to have these experiences. They are not allowing, or they are not letting us to have these uses, let's say, for the religious purposes, or also, let's say, for this sexual behavior or any other practices to improve our performance. So this is a restriction not only on the use of substances, but also on the use, on the fact of living these experiences. Would you like to explain this slide, Vero?
Bueno, tenga delay mi cámara.
I do believe that from the construction that we have from the Lamput and from this network of people who use drugs, the approach that we follow, it's important to convey this message. These three definitions that are really related, that they are not opposed to each other, but when we speak about discriminalization and we speak about depenalization, we speak about people. To depenalize all these tendencies on consumption, to discriminalize to those who use those drugs. And I think that legalization also, this is something that we've been fighting for that for so many years. We do believe that mainly with cannabis, this was the sense that they just wanted to get rid of the cáñamo, and it was by the 1900s. And so that need of legalizing will go together with those things that we've been discussing about this war against people and this war against drugs. So from the fact that in Colombia we're speaking about the peace, and that legalized coca would be something different, and it happens within this legalization process. And regulation, today we have a regulation, but this is a drug trafficking regulation, the powers that handle that, because in a certain space it is regulated, all that money that goes through it from these punitive actions and where substances and people who use substances are, this regulation would be something in favor of individuals, because in that sense we can speak about quality and we can speak about health issues. So regulating is something that has to be included within society, so we can have order to this depenalization and discriminalization. So I don't know if you want to add something else. Thank you. I just want to mention that this is really truly important, because these terms, these words have a relevance. In order to have this discussion, we need to know the concept. We need to know the meaning of these terms. Briefly, I want to explain, or mainly I want to mention, I won't stop on detail, the gap that we have within public policies as for this drugs issue. On the left-hand side, we have the ultra banning, and in that area, these illegal drugs are found. Cannabis, in some countries, the LSD and some others are found in this spectrum. And on the other side, we have the commercial promotion. And in that sense, that's a different possibility of this public policy. We say that we can see that some other drugs are included, that alcohol, tobacco, sugar. No, we can see that there are announcements, publicity, and different marketing strategies just to promote commercially these products. And in the middle, we have this strict legal regulation that, in that sense, yes, is to provide access as a difference to the ultra banning, but having these public policies and having these proper regulations and specific for the needs, not only for the population, but also taking into consideration those features of the substances. So in that sense, we can see that as for the cannabis topic, it has been displaced at a worldwide level from the ultra banning spectrum towards this legal strict regulation that we have seen that it happens in some countries such as Uruguay, Canada, and in some states of the United States. And alcohol and tobacco here in the graph, it's been shown that it's moving from the commercial promotion, because at least in my country in the last decades there were some announcements and TV ads, people drinking alcohol and smoking, and now that tendency has been to restrict these ways of commercial promotion. So let's just mention that there is a relation between habits and social harms, as we can see on that left-hand side with these banning, ultra banning, we have serious damages on social and health aspects, because we need to go to this violent market and all those topics that we already mentioned. But on the other hand, we have this commercial promotion, and in that sense, we also have that high levels of social harm and not only social but also health damages, because they are not only taking care of these substances, but they are also targeting the population that consume or that use drugs. I would like to add that we also sometimes include this health topic and social aspects, but now we can speak about developing aspects or growth aspects for those countries who crop these substances. And I think that Amaya was going to speak about these two slides.
Pues hemos visto hasta el momento, nos han explicado cómo la política prohibicionista es quien decide cómo tratar este fenómeno de drogas, ¿no? Pero nosotros hablamos desde la reducción de daños.
But we speak about from harm reduction aspect. But what is harm reduction? Well, harm reduction is a perspective that speaks about to implement, to design, and to assess all those services, policies, activities, tools, and to modify those laws as for do all the profiles of those users, so they can offer these health services to them and that apply according to the problematic that they are facing. Harm reduction also speaks about that not everything is abuse. Not all the people, not all the individuals who use drugs will follow the same treatment, and we also need to have policies that include the community. That it is not only that it is not only like this medicalization on the consumption, but also we need to speak about this complete and integral approach, so we can include all of those who use substances, because the right to health services and the right to have information are really violated when they decide to use drugs. So when they decide to use substances, what we're trying to change is to change this banning model that criminalizes, and that is really strict. And my colleagues have mentioned the only thing that they do is just to increase the harms and the damages, not only for us who decide to use drugs, but also within our communities. With this harm reduction policy, what we are trying to is to include individuals and to give the voice to them, to give voice to those who are suffering because of these policies. And in that sense, we can increase and we can also diversify the services, and we can also include all of them, not only on developing these policies, but also on creating services for them. As Fanny has mentioned, these policies, these harm reduction policies, had created these negative aspects that had affected to different populations, as well as to the Latin American region mainly. So in that sense, from civil society, several strategies have been developed in order to face and in order to tackle them. So on one hand, we have these support and counseling networks, and also these are not only formed by users, drugs users, but also from communities that had been disappeared. In Mexico, we promote this national brigade of disappeared people, who gathers those who had been affected or that had an impact in the country, in order to promote these search mechanisms for those who had been disappeared, and also access to justice. On the other hand, we have these self-management programs where users organize themselves in order to develop these care and health strategies for among themselves. How, for instance, this service that goes directly to different outreach, and also it's included in these decision-making processes. So this is the educative model, that includes this promotion. And this also helps a lot because it provides information for those psychoactive users. And we also have this political demand that it's made from some organizations, but also from these coalitions that are formed to change this paradigm. And as an example, I can mention this Regulación por la Paz. This is a coalition in Mexico that promotes cannabis with this social perspective. And as they were mentioning before, they belong also to LANPUT, this network of people who use drugs in Latin America. They also provide counseling in political and legal aspects, and the idea is to create this change in this type of behavior.
Muchas gracias, Monse.
Thank you very much, Monse. If some of my colleagues here would like to add something else before we divide the session into the groups, is there any additional comment?
Adelante.
I would like to say something, Sara, because most of us, as the Secretary of LANPUT and part of the project Alianza Impositivo, I would like to say hi to all the people involved in this. Some of the practices that we say is how this stigma, this discrimination, and this war against drugs also sets aside people who live with HIV. Sometimes they don't go because of this stigma and discriminalization, and some of them because they don't receive them, or some of those services are just conditioned. So within the framework of this conference, we as users, it is really important to remember that and to highlight the sense that we need to cover the need, to understand that harm reduction is beyond the way you use a substance. We understand that how you use it, injecting it represents a higher risk and also higher risk of infection. But what we're seeing is that some people also, they are just excluded from these services just because they are users. So in that sense, this is something that I wanted to remark and to highlight just for the breakout groups session. Thank you very much, Ernesto. I don't know if something else. I have some announcements before we move to the groups session. This session has been recorded and will be available in the social media HIV 2020 platform afterwards for you to be aware of that. And for the sessions, for the group session that we are dividing, we will have groups in English, Spanish, and Portuguese. So that's why it's important that you write down your name, close to your name, include the language that you would like to participate in, because they're just assigning the name, the groups, while we speak about with the 121 participants in this session, they will be divided. So we have people that speak Spanish, Russian, and there's a Spanish group that will remain here in this room. And the divided groups won't be recorded, but the plenary group, yes, will be recorded in Facebook, and later it will be edited. So those who speak Portuguese and English, please write down the language that you prefer, or Portuguese. We will have now 40 minutes, 30 minutes. We will have 30 minutes, 35 minutes for group discussion, so we can come back and share whatever happened in the groups. We will have 35 minutes, and Rachel now will lead us to some other exactly what's going to happen, but I'm ready. I'm going to the first group. See you there. to move on to the plenary session.
Creo que vamos a tener que ser muy veloces.
I think that we need to be really fast
en nuestra retroalimentación de qué es
on
lo
the feedback that we give. Let's go on the order of the groups.
Entonces con Ernesto, y si lo podemos tener corto.
Start with Ernesto, and if briefly you can speak in 2 minutes what happened within your group, which was in English. Maybe should I share the screen? Yes. Can you see it? I think that this exercise is good because we all did it different. So we just started the discussion. We have participants from the US, from Kenya, from India. So it was really interesting. And based on the first question, we analyzed that, let's say that this is like a classification on how to understand substances. What is a chemical substance? Having this definition from the World Health Organization that it alters your behavior. And we spoke about some substances such as tea, coffee, and sugar. No, we didn't spoke about alcohol or cannabis or some others, but we spoke about them. They also mentioned heroin, hashish, fentanyl, and so others. So we also spoke about the types of different use, the medical and non-medical use. We also spoke about the recreational, which this is a concept that from the input and from the network of users, we just tried to get rid of this myth, because sometimes we don't use it just for recreational purposes, that everything is for game purposes and that we are just lunars, no? So in fact, there are so many uses. And also these effects in the central system, such as stimulants and depressants. And also, well, what are the drugs to speak about illegal and legal, no? What are the legal ones, such as alcohol, that it's only for people who have the majority of age. So, and when we speak about chocolate, also, well, even my child can go and buy it. So we spoke about also the drug policies, and we spoke about the state regulation of cannabis in the US, and that it depends on the states. There were some other interesting comments that, for instance, that they say that this prohibition law was exported from the US, and we, from all the other countries, we've been importing this war against drugs for more than 30 to 40 years now, and how this has turned us on using these terms of criminals and users, and that giving the labeling and that stigma that if we are users, then we are sick people, and that we have this disorder that is called addiction, and if we are criminal, we are also criminals because we sell drugs, and how this prohibition gives that sense to that. And also in the, it is also created more altered products, and how that is based in this law and order, in this judiciary policy, and in this incarceration system. And just to close this, what are these stigmas? What we see is that these drug policies have these racist issues. They just separate black from white people. And they are also patriarchal, or having these macho attitudes. And they are also centered in adults. I mean, we can say that they are based in colonialism, because how they are imported from the US. Moving on, we spoke about sex work. Also, we spoke about the intersectionality with some other populations, such as sex workers, and as well as trans population, and how the stigma increases, and then it makes it more complicated. So we were also able to add some strategies for harm reduction. Should I go back? Well, I think that
Solo para dar tiempo a, porque son...
Just to give time for the rest of the groups, because there are 6 or 7 groups. So let's move on to the next group. How should I stop sharing?
Y el grupo de Angélica y Jorge.
So the group of Angélica and Jorge, they you don't have to share your screen. We can see your faces. Thank you, Ernesto.
Hola. Bueno, pues un poco de lo que se compartió en el grupo.
Some of the ideas that we share in the group that we were coordinating. As for what are drugs, well, they mentioned that there are several substances, and specifically mentioning that these are products that help us to interact with our environment as well as with our communities. So we can think and we can reflect on ourselves, but also on our surroundings. And also, well, we have that discussion in that sense on which are the ones that are legal and which are the ones that are illegal. And we even reflect on the fact about the coffee, how it is a product that it's available and that it's and that it's also considered a psychoactive substance. As for drug policies, we mentioned that there are certain regulations and legislations that are defined by public authorities or governmental authorities in a supposed motive to protect our health, but it is covered by this progressist policy and having this policy of social control. As for stigma, that is faced with this situation and by those who use drugs, we mentioned extortion, we mentioned criminalization, bribing, and also the reduction on the capacity that we have as drug users and the lack of knowledge that we have as political actors that we can demand our rights. So there's also this liaison between the official discourses or the discourses from the social media or the media itself, and that in a general basis, they are just reinforcing the situation. As for harm reduction and risks, harm reduction, we spoke about ongoing education. We also mentioned peer-to-peer education, that it has to be, they have to be paid honorably, and also the relation between the communities with this human rights perspective. And also it has to be considered that these specific features of the substances, but also the features and specific needs of those populations and of the individuals at the moment that we develop these strategies and services with regards of the topic of drugs. And as for policies, we just need to mention the topic of the relevance of being able to know what are your rights in order to face those political injustices or state ones. Also, we need to assess the costs that in terms of criminalization against health aspects, public health, and how they are involved. Thank you very much, Jorge. Emir Franco, you raise your hand. Do you want to share something?
No, creo que quedó de ahí levantado.
Ok, gracias, no te preocupes. Ingrid y Arturo.
Ingrid and Arturo.
Que hablan portugués, ¿cuáles fueron algunas de las conclusiones?
What are the conclusions that you were able to gather from your group?
Mejor en español, porque ellos están haciendo una traducción.
En portuñol.
Ok, portuñol es bueno siempre.
Okay, I will try to speak portuñol. So, most of the things that they mentioned, it's included in all the things that we think. So we just took notes with regards of the second and third questions. What are drugs? For that question, we just kept the concept of the World Health Organization, that we think that that's a generalized term on what are drugs and what are these substances. That this is a chemical substance, recognizing that this term can be used for other, for those non-proper uses such as stigma and discrimination. So in that sense, we are just a small group of 5 individuals, and we believe that these are the interventions that are directed to those who use drugs for a specific community, and with their participation and with this, with their initiative, they should consider this subjectivity that exists in a specific territory. For those cultural, social, and local aspects are also considered as practices within a specific service for those who use drugs. With regards to social stigma, we've experienced we've lived certain discrimination and stigma related with drugs. And we think that this social construction is something that has to be done, proposing for our bodies, and the class, race, and gender are important, that should be included, at least here in Brazil, because that increases mortality rates and incarceration. It also creates social segregation, and it is also centered in poverty and vulnerable people in Brazil. So these are the evidence that we have for the 3 first questions. With regards to policies and harm reduction policies, we can say that the change on this prohibition policy that considers those who use drugs was in a certain way in the group was unanimous.
Monse Ibero.
Sí.
Después vamos.
Thank you very much, Arturo. Now let's go to Monse and Vero. When we think about this term, we agree that this is a substance that alters and modifies the body and creates certain kind of alteration, and it could be coffee, sugar, tea, and so many more. So also antiretrovirals and hormones are considered substances that can be used for recreational purposes or therapeutic purposes. And they also mentioned that we can have this double game on the use, because it's also an excuse to maintain this banning and the criminalization, as well as the stigma of those who use it. We spoke about these therapeutic and pharmacological uses, and it is sometimes not even spoken about it. In some other populations, they might be using specific substances. And we cannot say that we are anti-drugs, because we're always using them. So as for the policies, they mentioned that they have always been restrictive, and that they also create this social stigma, that they affect their communities and the users, but also the ones that produce it. So we need to rethink about what are the legal substances and what are the illegal ones. And also this topic has to be included on the change. The challenge is to speak about that. It also has to deal with how we want to include it. As for stigma, this is a level that affects the individuals and also creates discrimination because of these categories that also they are being multiplied. Let's say that there is a homosexual person, and you can create these inequalities if you add some other labels. As on how can we reduce harm and damages with regards of the use of drugs? Well, we need to implement education based on scientific evidence. It also has to be based on different strategies on the use, on inhibitors, and on primary services also. They also mentioned that methadone is a substance that can be used and can help. As for the drug policy, harm reduction can be done with this regulation that it's aligned to the health systems.
Adelante, Fanny o Cynthia.
Yes, Fanny or Cynthia, and then we will finish with Amaya. We were there with 13 people from Ecuador, Uruguay, Mexico, and Baja California, Mexico. So what are drugs? This is just a substance that when you just introduce it into the body, there are certain changes. It was also mentioned that they are sometimes used just as an escape to avoid conflicts, and that we were mentioning that they don't mention why they use substances, but in this category we should speak about why people use substances. This could be like more a spiritual issue because they are in rehab processes. Substances then can have different type of usages, and then how the categories of these substances, or sorry, with regards of these drug policies, when they are regulated, then they criminalize individuals, they stigmatize them, and drug policies kill by having these liaisons with this labeling and these stereotypes, mainly when we speak about women that live in this diversity, because sometimes this stigma create this violence against trans women. So we also have these feminicide cases in different areas, in different regions that were included in this group. We also, within the policies topic, we need to include the re-education at social levels, not only speak about HIV, but also we need to speak about the problems that you can face when, let's say, that you are in a party to get robbed, and these policies help a lot for stigmatization. They don't show exactly an openness, and they are not based on human rights. So in that sense, for us, the policies, we concluded that these are aggressive, that these policies are aggressive and that they do not respect, and that these policies have to be changed. Also, how they have experienced them, or how this stigma is, or this discrimination is related with them. We also spoke about the change on the law, and the group of Ecuador mentioned that yes, the law is stated that they have to have this openness, that they shouldn't be stigmatized, but in reality that doesn't happen. So we need to create a change in the law in order to avoid this stigma. There were some also psychologists that work with HIV people, and what they mentioned is that they don't have access to treatment because they use psychoactive legal drugs. It is not the same when a person says that they are alcohol consumers. The medical attention that they give, they receive it. Okay, then we can give you this care and this attention, and then you should stop drinking. But when someone else mentioned that they are consumers of illegal drugs, they don't even receive the service, the medical service. So there's a lot of stigma with these individuals who decide to consume and use drugs, and mainly when they are also HIV positive. So how can we reduce harm reduction? In that sense, we concluded that we need to re-educate. We need to propose not only for consumption, but also for the producers of the plants and the herbs. We also need to get rid of these moral behaviors and attitudes. We need to see it from a human rights and public health approach. We need to include cannabis as a medicine, as an essential medicine for those living with HIV, because they were mentioning that it helps a lot, that it supports them. And we need to re-educate on harm reduction for those who use substances in order to have a better knowledge on what is the impact in their own health and how it has this intersectionality with retrovirals and any other medicine or drug that they are using. And finally, how these harm reductions are being diminished. Well, we need to re-educate the health system, we need to re-educate the penitentiary system, and we need to create this awareness and to sensitize these community servants, because they should not be in this mood of guaranteeing, and they need to guarantee that, because public servants also, they are the ones who violate these human rights. With regards of the participation of users and consumers and HIV positive people, they need to be involved in the creation of these public policies. This is important. There shouldn't be the creation of these policies without including these users and without knowing what are their needs. Finally, Amaya and Marisela.
Muchas gracias. Yo hablo fuerte porque me enseñaba. Nosotros nos han enseñado a callarnos siempre, toda la vida y más como mujeres trans.
¿Quién va a hablar de ustedes? Solo para saber.
Sí, sí. Gracias a todo el grupo. No nos pudimos despedir.
Thank you, everybody. We weren't able to say goodbye because of the time. We could have continued with this discussion, but going faster but slow for the interpretation purposes. As for the drugs topic, we spoke about that there are several relations with these substances in different moments of the life of the people who consume and who use them, and the different type of substances. That these are substances that when you use them, they create this change in your nervous system, and then it creates several senses, change in the senses, and there's also some legal and some illegal. We spoke about sugar, and we spoke about heroin. As for the policies, we spoke about two dimensions. We spoke about the state definitions, and the public policies make you feel a drug addict, and they make you feel like as a sick person. So there are certain regulations that are related on controlling and managing how we relate with them. We also spoke about those policies and what we do as civil society. We need to give visibilization to those who suffer a lot of discrimination nowadays, and how to create these new spaces to support them, and that those are also spaces that the civil society has questioned the state. As of how it is linked stigma with those users, we spoke about the lack of health services, the lack of an identity, the lack of health services as a free transit. We spoke about these arbitrary detentions, and we also mentioned that this general stigma created by these drug policies had created these human rights violations. We spoke also about the general idea of facing the law, and that also for legal substances there's a stigma, and there are some doctors, for instance, that they have this stigma for those who use antidepressants. They ask you questions, but more than that, they just give you comments. And it was also highlighted that this stigma, it's a way on denying access to services, on how people look, and what are the resources, and in a way it's some kind of control. And there's also the type of use and the economic aspect to different substances. On how to reduce harm and damage, we highlighted the fact that the relevance that we need to share information, mainly peer-to-peer, in order to make responsible decision process in the decision-making processes. also to reinforce this information related with the consumer and the consequences and how to reduce those consequences at the moment that drug is consumed. Also to have this implementation of health services when they need it, provide information on the services that they have available for them. And as for drug policies, we agree in general terms that the first is to eliminate those stigmas because that creates a lot of damage. If there's no stigma, if there's no stigma, there's no discrimination and there's more access to information. We need to reinforce that participation of users so we can decide more on our needs. These harm reduction measures are not a measure from civil society, but they should come from the state, and we should reinforce this information to politicians, but not also to reduce this harm, but also speaking about benefits and training them on how to be more empathetic and how to reach and how to get information so they can have this evidence not based on these subjective ideas. We also highlighted the fact that we should have information on our rights so we can defend them, so we can protect them, and we are able to identify when these rights are being violated. We also spoke about this comprehensive prevention, that it's focused more not only on how they use the substance, but also it's on the collective level, and that the collective is objective but not a subject of rejection. And we also spoke about that criminalization is the highest risk, and we as users, we need to fight for regulation, because criminalization is the hardest crime. So we need to integrate these organizations so we can promote this topic and create these changes, and to support each other as peers, not only to make those rights being heard, but also to be implemented. Thank you, Amaya, and we're about to reach the end of this session. In the chat, there are two surveys. One is in English and the other one is in Spanish. So please take your time to answer that survey. I will share now the screen just to show you 3 final slides. Vero, you were going to read it. You were going to explain the use of substances and HIV just to see this liaison. So I don't know if Vero is still here. So mainly this covers the topic of harm reduction and what are some of the risks that can be included within the use of substances if a person lives with HIV, and how can we reduce these harms. So how can we reduce those on the use of crack and bazooka? Well, the better is not to share the pipes and not to use metal or tin materials in order to avoid these interaction of substances or to recycle these materials. And this was important to highlight because in our region, for instance, the consumption of smokable cocaine, it's broad in some other areas with the injection of substances. So we can see that within the education of substances, we also need to prevent. We are preventing here HIV transmission. We have good education levels, yes, and mainly also the great stigma that we face with regards of the use of substances and the use of antiretrovirals. There is this interaction, and sometimes we say, for instance, if they are drinking alcohol, well, yes, you can take them also with antiretrovirals, and then you can use them with some other substances. It is not the most convenient, of course, and the idea is not to promote the use of alcohol and antiretrovirals, but it is also important that there's no that interaction. That interaction doesn't exist, and then we choose. Something else that I wanted to highlight here is that the use and abuse of substances on a regular basis are illegal. Tobacco and alcohol goes together with these psychopharmaceutical products, and we need to be aware of that. With some substances, so many doctors don't know and don't speak about that clonazepam that they are using, and they are recommending that they are using these legal drugs. Another aspect here is with the use of substances and HIV, being aside from these health services, because sometimes there are several timing schedule, mainly in key communities. Sometimes we have different timings. We won't be able to be there fasting in the morning or maybe during the evening. So that's really important to consider, to being able to defend and to protect those rights, and to have these inclusive services, not only for during the day or during the evening, but also during the night. Also, we spoke about the programs and the policies that are developed in favor of those who use substances, because if certain programs are creating this impact, and then we will be set apart or aside because we don't belong to those. And speaking about Latin America and the Caribbean, and on the other hand, it is important to know that the main objective, or the main product that we have is also condoms, to make it available, because sometimes they say that they prefer to buy the drug rather than buying condoms.
Exacto, sin duda, y por eso nosotros creemos.
Yes, and that's why it is real that we need to have this legal regulation. We need to have this education based on evidence. We need to have this information based in evidence without any prejudice. We have the right to make decisions on our bodies and what we want to consume, what we want to use, and that there's also a self-regulation that happens in our daily lives. As in any other life, I mean, we have this control on the habits of what we do, on what we consume, and that, of course, there is this prevention. Regulation doesn't mean that there's no prevention towards certain sectors of society, but there's also this education based on society. So it offers safe access for health services that are proper to the needs of those who use drugs. These harm reduction and risk strategies, as we have spoken about them, access to this product and essential services, and also to have these public policies that cover discrimination and stigma that are faced by these individuals who use drugs. And we have seen that we might need 2 or 3 hours more to discuss about this, on what is there in the market, or what we imagine that is there in order to have this safe access and legal regulation. But there are so many examples, such as medication, alcohol, tobacco, cannabis for this medicinal and personal usage. Also this self-harvesting and this medical use of heroin under the use of this prescription that is now in Canada, and also the idea on how to include this community to these marketing sectors. This is one of the main concerns, not only in Mexico, but also in Colombia and in some other countries that produce. Also, speaking about the sale, it's been exclusive in certain areas with less labeling rules to offer opioid, not only to smoke other heroin or that is mixed with some other products that's considered illegal under this banning scheme. Also, to have this harm reduction information, we need people such as Fanny in those spaces, because they will help us to make better decisions on the use of drugs. We also need to have these consumption spaces that could be restricted or not, with requirements, with these medicinal purposes of social recreational activities. We want to gather, we like to gather together, and we just see that living all these confinement situation, we like to see each other. We would like to have these safe spaces where, besides that, if you need water, or if you need food, or if you need information, you can share that. We have these examples of these coffee shops in the Netherlands. But also to inhale. So we also need to integrate this social justice to protect the harvesting communities and to assure access and quality for those who use psychoactive substances. So we believe that this is possible. We believe that this is something fundamental in order to reform drug policies. So they can include in the center the individuals, but not the substances. And in that way, we can reduce the risks and we can have this harm reduction and we can promote pleasure in order to enjoy at the maximum this life. We do believe that this exercise is really important, and mainly in those spaces where sometimes we just speak about injecting drugs, so we can expand and we can speak more about this topic. So we kindly thank you, your participation. We also like to thank the interpreters who help us to have this exchange of languages, and also the organizers and everybody who was involved as moderators and speakers. It's been a collective effort with several phone calls to prepare this session. And here in the chat, we have the link for you to assess and evaluate this session, and also to keep and to remain in contact if you want to add to the LANPUT, to the Latin American Network of Drug Policies at a local or national level. We want to continue with this movement so we can diversify and grow, and we are more and more involved. That you don't need to consume drugs or to use drugs. You just need to believe that this is the best path and that this prohibition law has not worked, and that there is a different alternative that can work for our countries and our communities. So in the chat box, you will find the survey evaluation, and I think that we